as what do you call it? A program to re-emphasize and re help everybody get current. I think that's what we could use with the psychotherapy. Today, the core thing we have is starting the program, and usually when you start a program, it's best for people to have an idea where we are all coming from. So one of the things, or the basic thing we're going to do this morning, is to situate psychotherapy in Nigeria and let us see how it is compared to how it has ever always been in Nigeria. Nigeria is not in a new place. This is not the first time we are doing psychotherapy in Nigeria. So it's important to let's see how the history has evolved from start. We've had a do, yeah, I think that's what we should do. And I'm asking if Dr. Abiola is ready to take us through the origin and the history of psychotherapy in Nigeria. Dr. Abiola, I don't know if you're ready to do that now.
Uh,
Or is there any other thing you want to say before then?
no, no, sir. I'm ready. Let me try and share my screen, sir. Please,
Please share your screen and do that. What we'll do is have a discussion. Abiola is leading it's going to be an interactive session actually. So after having a few well, after Dr. Abiola has taken us through, we'll have a detailed discussion on it. And I think it is during the discussion that the basic things about it would really come out. So let's get ready, make your notes so that the discussion will be based on it, and anything that has been left out, we'll be able to add it as we discuss some. So Dr. Abiola, please share your screen and let's go on.
thank you very much, Prof. Once again. Please let me ask if everyone can see my screen. I've shared it. I hope we can see it. Can we see my screen?
Yes, sir.
Okay, thank you, ma. I'm in full screen mode, and I hope you
Yeah,
can.
we've seen the history of psychotherapy in Nigeria.
Yes. Thank you very much, Prof. Thank you for everyone being on board. I will be looking at it from an evolutionary perspective. And this lecture has been uh, designed and developed with very strong support and input and many material support from Professor Udofia. And also there are some input also from some of our other elders like Professor Eri, Professor Aina, and the rest. They gave some input, but Professor Udofia do give a big chunk of it. And let me take us to the next slide. That the uh, this aspect of we want us to be able to look at things through these following vistas orientation by trying to look at each epoch in time, and from each epoch we'll try to look at what is the introduction of psychotherapies like, what are the historical definitions of it, and what are the historical development that take place there. Then we'll go to where we are now. We want to move forward. We get to conclusion. Then definitely we'll not follow by the discussion, which will be the main part of this presentation. And the purpose is that by laying this foundation as we have been guided, that it will help us to move forward subsequently. By introduction, these aspects will look at the each epoch, each era of how psychotherapy have developed in Nigeria. And this is by looking at it from the following three perspective: from the pre-colonial holistic healing to the colonial biomedical dominance and the post-colonial hybridity. These three areas are very vital when we are trying to look at the history of health generally in Nigeria. And this has been the pattern employed by historians. And this is also very vital to what we'll be discussing about when we want to look at how psychotherapy has evolved in Nigeria. And we're all aware before the colonial masters came, we have way that we heal ourselves. When they come, there is the imposition of their own approach, which is the colonial dominance, which is the biomedical model. And after we gain independence, there will be some development and there's some hybridity of several modalities that have come together. So, and how those intertwined, we try to look at it. Then we'll make our input to see how this could help us to lay the right foundation for what we're discussing. Please, as part of the rule, if we are not speaking yet, can we please mute ourselves? Thank you. Based on those three eras have a way we can define them. And by looking at it, we look at what's the definition of psychotherapy in the pre-colonial holistic healing. And the definition, by looking at it, is what has been suggested there. By it's a way of holistic approach to treating the disordered mind and especially the troubled spirit, deeply rooted in cultural beliefs, spiritual practices, and community support. One of the things to take note here is the spirit. And interestingly, that is also where psychology starts from. The psyche there did not initially imply mind, it implied the person's spirit. And so there's a way that the history of the world also seems to mingle, but with the coming of the biomedical model, that we have to look at an entity to treat out and the dominance of it, then that spirit is changed to mind. And that takes us to how the colonial biomedical dominance define what psychotherapy is like. That is a medical approach to treating mental illness based on predominantly Western psychotherapeutic models, and they emphasize institutional care. And I'm sure for most of us who have read one history or the other, we'll see that that is how, in the colonial area, that is how medicine generally is. And every aspect of medicine, including psychotherapy as one of the treatment modality, have also taught on this part. And the last aspect, which is the postcolonial hybridity, is to look at, by definition, look at this as an evolving approach to psychotherapeutic care that combines elements of Western psychotherapy with traditional African psychotherapeutic practices and some other practices across the world, which some people might be talking of what would be the role of acupuncture and things like that, that many people try to introduce. Neuro-linguistic programming is not strictly Western, it's not strictly Eastern. There are so many varieties of it. Mindfulness is not Western, but it's borrowed into the Western literature and being dominated by the Western. So many things are merging up in this era. And that is why the aim is to provide a culturally relevant and effective psycho-emotive treatment. So this is how, looking at it, the evolution of the definitions of psychotherapy as look at. And also part of the evolution is to look at the development and how it has grown. The the pre-colonial era, people that practice health sciences and that provide healing, whom we might call in our modern language healthcare workers, are predominantly divided into two broad groups: the herbalists and the diviners. And I've tried to give us based on the three common language in Nigeria. And I'm sure in every other dialect in Nigeria, they have this clear, distinct understanding. We have herbs and the herbalists, like we know, they're the one that look at the herbs, make concoctions, uh, grind it, dry it. This is so many formats, and give it to the individual to swallow or to rub on the body. And such practices have been part of what is appointed. Please, can we mute ourselves? Just hello, thank you. So, so the herbalists, like we know, that these are the main name for them. In the Yoruba, they are referred to as Onisegun. But the Hausa, they have a name that is so broad called the Boka. And the Boka implies that it's the Magani, that's the person who provide the apps, the medications that is needed, the traditional medication. And the Igbo language too is also look at it as Dibia. The Dibia is also broad and it's also grouped them into those that provide that may have this thing called the Mgborogwo, while the diviners who practice psychotherapy in their own unique way are usually refers to Babalawo if it's a male or Yanifa if it's a female. And in the Hausa, they are calling them Meduba. And in the Igbo, they call it Afa. Dibia Afa. So these are the way the pre-colonial period have conceptualized those who provide and contribute to the healing process. Of course, their approach we might think are not rooted in science, but they have their understanding of how this is, whether through experimentation, through knowledge passage that are taken through generations to generation, but usually uh, uh, coded in a family system, in a familiar pattern that become like the profession of that family. You'll find this practice like that. In as much as our talk will be looking at the diviners, which is where psychotherapy will be, then we'll try to see how this have evolved in our historical development and growth. In essence, based on the evolution of this, the herbalists, we can look at them as evolved into so many practitioners in our current experience now. We have people we call the doctors, they still do part of the herbalist system. In quotes, we have the pharmacists, the nurses, the laboratory scientists, the health information managers, other health related professionals. They contribute one thing or the other, which the herbalists in essence used to do in the past. Whereas in the current time, we have the diviners, which also have various people that move, like the advisors, the coaches. Sorry about the spelling there. We have the mentors, we have the counselors, then we have the psychotherapists, which is where we are looking at, and the medical psychotherapists, which are psychotherapists, but that they have a background training as medical practitioners. So this helps us to be able to appreciate how those two has evolved in our current eras. So we might not look at psychotherapists as diviners, but that is the evolution of it in Nigeria. Usually, some member of those people in that family who are so intrigued by it choose to specialize in part of the uh, medical profession, the health profession that deals with the aspect of this. And for those who are herbalists like that, and now be the openness of it, the biomedical dominance, where a lot of people are needed to provide health for the large population in the country. And so this also contributes to why more people are welcoming to the profession. It's no longer limited to exclusive benefits of the who is who in the community or a family lineage or hegemony that this may be moved through as such. So based on that, we can try to look how those people exist in that pre-colonial holistic healing forms. And because we have tried to look at the pre-colonial time and look at the three separation of the psychotherapies that we have then and their local names, we try to look at what are the psychotherapeutic role, what can the type of skills they input into this, how did they apply it, and what are the modern ways we try to describe them. And that is what this table is trying to show us. Typically, the Babalawos that usually serve as the priest, the spiritual guide, and they provide healing through therapeutic ways. And that is why they also referred as healer. But now the healing is through the talking system rather than giving apps. And they also play additional role, which they serve as mediators between the humans and the deities, the gods, which are referred to as Orisha. But the Igbo land is also similar like that. But often, they instead of calling it as mediator, they refer to that as interpreter of the spiritual world. So, and that's why they serve as advisor to the deities in order to give guidance and pathway for the community to embrace, either for individual or the community to embrace a true spoken words to get healing for them. Similarly, in the Hausa culture, they are also look, but often that spiritual context is not well they're separated from it, and often some of them are recognized as spiritual consultants, and they serve as what mainly as protector against evil forces. They don't at times may not refer to themselves as advisors, but they believe they have mechanisms, the speaking modality, which one of our fathers there, Professor Marakio, which he called Rukia, has identified that yes, this is one of the psychotherapeutic skills that people do have to use in order to be able to achieve healing in the process. So, and that moves me to the other healing skills that the Boka do use. They use divination, which is applied by Hall. They use herbal medicine. Some of them still mix the two together. and they use Quranic healing system through the Ruqya recitation and incantation, like in quotes, and that's the Hausa version. Whereas the Yoruba also have incantation, and the Igbo, they also have their incantation, but unique to the cultural practices and the religious dominance that exists there. And also is the practice of use of amulets in different ways. All of them use amulets, but it might be more predominant among the Hausa practitioner to give amulet or to give religious writings in water and provide it for. So the similar thing can also be seen in among,
So sorry, sir.
yeah.
So sorry to interrupt you. We've been trying to get your attention. Your slides are not moving, actually. We've been on the title slide for a while now, and we're not sure. Okay.
Okay, sorry, I went
And it's
full
not in
screen.
slideshow. Okay.
No, but is
Thank
it
you.
moving now?
Well, we can see pre-colonial holistic healing now.
Okay, my apology. I
Thank you.
went to full
Thank
screen, but
you.
it's not displayed there. So please, I hope this is clear enough. I may have to adapt this to move on with the other part of the presentation.
Okay, sir.
Okay,
Thank you.
thank you very much. Thanks for the observation. So, okay, okay, thank you for the observation. And it is through that same pattern that all this move through, that we can look at it, that their skills are not that different from one another in the pre-colonial time. However, their application is to treat similar challenges, which we understood as mental illness now, which can be psychological, emotional, and all related in that space. And usually they also have a way to diagnose. They have their own diagnostic manner, which they usually memorized. And from that memorized diagnosis, that's what we guide them towards the kind of psychotherapeutic application methods or treatment that they're going to provide. And they're not usually, it's not one thing for based on the diagnosis. It is based on the diagnosis they made that determines or that predicts what they will do, the kind of psychotherapeutic application they'll provide traditionally in the colonial era. In the modern times, we still understand it, we refer to them as traditional healer or spiritual counselors, or in the outside this thing, they are more understood as Islamic spiritual healers. I hope I've moved to the next slide. I hope we can see that.
Yes, yes.
Thank you very much. So let me adapt this. Okay. Then the next thing to look at is we are moving to the now the colonial era where there is biomedical dominance. And this is not unique to Nigeria. This is everywhere the Western world and the Western dominance is. This is how they practice medicine. They are also trying to change from their own historical past to try to embrace science where they can scientific methods become predominant. So try to look at everything from the scientific viewpoint, and that leads to the biomedical predominance. However, in the Nigeria context, these are usually limitedly used in the Nigeria context because the biomedical dominance did not promote more of the psychotherapeutic practices or use in that era. Because the development of those sciences are coming and the influx of them are limited. There we do have some colonial psychiatrists, some colonial mental health nurses, some colonial pharmacists and things that play a role. They are expatriates and their interpretation are usually biased. And some of them do have that view that the African mind, which is the concept they created, is cannot undergo what is called psychologization. And because of that, applying psychotherapy for them might be a waste. So they tend to push more towards, which is the biomedical model, neglecting the medical aspect of it. We know we do talk of biopsychosocial. So that psycho part of it is missing. So the biomedical model look more at the biological aspect, not looking at the psychology, the psychosocial aspect. It's not looking at it more. So that in a way dampens what psychotherapy should look like in that era. Yes, the sciences were developing. We know there is influx of predominance of the psychoanalysis and all the other that offshoots of it, the psychodynamic models that are offshoot from it. Then many other models came through, like the behaviorisms. From there, we have the emergence of the cognitive model, which has been existent much earlier before this psychoanalytic, but it's not a Western orientation, it's Eastern orientation. And all this have played role together to come that okay, there are sciences and there are theories that are being used in order to be able to help to use the talking ways to get healing. So they have a theoretical basis, they have core skills that are applicable there, and they have ways to apply them, and they have what it means to get healing, which is why they can know whether the process is working or otherwise. So this is the predominant thing that there. However, the challenge of now is because of institutionalization that reduce the number of people that might have access to even where this is available. And still following the same pattern is to look at what are the psychotherapeutic theory as propounded in that area, looking at the theoretical framework, what is their focus, their utilization, and whether there's some indigenous adaptation, which are very, very, very difficult. And that is because they are usually suppressed and dominated by the others. So the theoretical framework is usually Western psychotherapeutic in origin, and the skills usually practiced from the theoretical framework is to make diagnosis, classify what the illness is about, which has given back to our current classificatory system of understanding illness, which are the DSM and the ICD, and their different precursors. And then we apply it based on the Western psychiatric theories to diagnose and treat mental illness. This does have some limitation because of cultural sensitivity, which might not really speak to, and it is because of inability to dominate, to adapt those in our cultural context that might make those colonial mental health providers to think the African man cannot have psychological processing in their mind, and that's why they do look say the African mind is that of a child that is stagnated in the concrete stage of development of Jim Piaget. Uh, then, looking at that, what is the focus? The focus of the Western model is to make diagnosis and to apply this to based on the type of diagnosis they make. So the diagnosis may vary based on the skill and expertise of the person providing it. So if the person is a core mental health provider, their diagnostic differs. From when somebody is at the fringe, the diagnosis person would differ. And what the person can apply or provide will also be based on the level of depth of knowledge and skills that you need to have. And that is usually the focus. And most of the practices are in the asylums, and that is where we have most of our first set of psychiatric hospitals to be referred to as asylum. But now they've evolved and become federal neuropsychiatric hospitals. We still have some states that may still have asylums, but open that they are evolving, and some states have also do better than what was there before. And the utilization, like I've said, is very limited because most people that are biomedical in orientation, they don't believe psychotherapy work. They don't believe talking cure works. And because of that, that limited the application of it and the use of it often by those people. Okay. So that takes me to the next slide. And what is the way our diviners are looked at as at that time? All of them are marginalized, they are stigmatized, they see them as oppositional. And because of that, it becomes difficult for them to accept what the Western, because the Western is trying to dominate them, it's not trying to dance with them. The Western come as the Goliath, who is a giant, and they are trying to see us as David, but they could not overcome the Goliath. So and instead of them to try and die and dance with the Goliath, it becomes difficult. So they felt the 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 suppression, and that limited their being in the forefront or looking at some of the uh, healing or the LD aspect of their practice that will be very helpful then. And their skills, the same thing that all of them brought are, and that is where most of them now have to now go spiritual. So most of them focus now on the spiritual aspect of things, and because of that, and the evolving of science, understanding what spirituality is as distinct element of in its own, rather than being part and parcel always of spiritual of religiosity, that science is also developing. And because of not much understanding in that area, they evolve more to become spiritually connected. And that is why most of what used to be practical, uh, like practical mechanism and framework of interpreting illness now become being given spiritual entity in order to still maintain their kind of clientele and be able to treat them in the process. So what they might call spiritual now, let's put it in code, might not be essentially what is understood to be spirituality, but they try to merge it there, force it there in order to still be relevant in that area, despite the suppression and marginalization that take place there. And the third era, that's after independence, we have the colonial hybridity. In this, we look at it in two phases. There's some post-colonial developments and the post-colonial hybridity that have occurred. Some colonial developments that occur witness the following adaptations of those colonial dominants. Innovations were brought into them. Indigenous psychotherapy find its way there, and then we have a new synthesis. And all these were very helpful in what we know historically, and that is why one of the most celebrated system of managing mental health, with its psychotherapeutic aspect there, is the Aro Village System, and that is well captured in one of that system, and other that take place there, and more added to it is well captured in the development of some uniquely Nigerian therapies, and that is what's well seen in the in what you is referred to as psychotherapy by environmental manipulation. And this is one of those indigenous therapy that has been developed. They have their deep roots in Nigeria, and there have been published the research on this to show that yes, it works, and it's still being used by not only the diviners as we understand in the olden days. The involvement of the diviners have also separated, where we have clergies being part of it, are now recognized part of the diviners, which is part of our colonial inheritance. The religious came in, and so some of the adaptation of the religious practices to look at psychotherapeutic that works for our uh, entity, our system, that also help to that. So environmental manipulation is one of those used. We have the Meseron, which is similar in a way. That's from the Iberian language, similar in a way to cognitive pattern of doing therapy. We also have the harmony restoration, which is trying to say that for the human being, which is one of the big foundation for existential therapy, which is one of those therapy that is developed from psychology rather than, I mean, that developed from philosophy rather than from psychology, but it has so much deep use that is helpful, and it can help to answer and deal with so many existential questions, which bring a lot of existential anxiety and depression that leads to a lot of suffering for people. But in the Nigeria context, look at it and develop uniquely what is called harmony restoration, where you look at the individuals having three level of existence and the harmonization of the three being harmony with one another. The individual needs that in order for the individual to be existentially sound and be able to navigate life better. Then we also have newly emerging ones, which are in the colonial one, like the Maiduguri Monotheistic Existential Therapy, which is one of such that was evolved because of the Boko Haram challenge, the existential problems that people face, because of that terrorism and insurgency in nature, and that they will need something to be able to address the existential problem they create. And more of recent is the ultra brief intervention for psychotrauma, trying to look at all the theories that exist about psychological well-being and using that to create a treatment approach that will be easier, shorter, and will be effective to help people in so that it can easily be taught around. The That is one of the first phase that is developing. Those are development that keep going and the growth. Then the hybridity that comes is that the integration of the Western psychological theories with indigenous psychotherapeutic healing traditions. And the emphasis here is moving to how the world is going, which is called the holistic medicine. Everybody is trying to look at what role now spirituality actually plays. Is spirituality going to be understood from the past that were mainly traditional activities, traditional culture, traditional religious practices, which might not be spiritual in their own way. And the sufferings that come as a result, now we just label everything spirituality, or we are going to understand what spirituality essentially is as distinct from the science, as distinct from religiosity. But religiosity can help somebody to become spiritual if it's practiced the right way. People can become religious and still not be spiritual. So all this is coming up and trying to see how this will be fused together. So the hybridity is challenging, and we hope the discussion will look at that more. And now, our three levels of local diviners that have been looked, how are they now based on this hybridity? And now they serve more as cultural mediators. There's one being called, come and tell us about the culture of what is happening. And they are the one who try to now say, okay, they are the expert to integrate the traditional with the modern psychological practice. That's the play. The community healers, and cultural preservationists, they serve as that. And for somebody to be able to do this effectively, he must belong to such association or to their group, so that, and that is Bible. That's why you be able to blend, intertwine the traditional, the modern approaches. But that's similar is also evolving the spiritual approach to it, and how will that be integrated in the Islamic and traditional practice. And this has also have its own impetus, which is now understood as Islamic psychology, trying to see how spirituality from the Islamic perspective is evolving. And so these are some of the development that is taking place in terms of the psychotherapeutic role. The skills are still not that far from one another, but trying to look at it and to get to stock to what they evolved to in the colonial era, trying to now spread it and grow more, rather than to look at it that the hybridity should take place. But no, the rigidity of what they have is also meeting the rigidity of the Western dominance. And the two is finding it difficult to really fuse together. But there have been some successful fusion, but there are still challenges that are there along the rim. And the applications also there, but by understanding all the cultural practices are, it makes it easier to be able to address the psychological sufferings through this talking therapy approaches for somebody who try to understand what the tools are and be able to apply it. And that also try to bring to it the spiritual understanding from the cultural perspective, from the scientific viewpoint, and how that will be able to address the issues that are there. And in the modern times, the Babalawo and Onifa usually look at the cultural psychologists. They are often referred to that, and some of them even label themselves as that. And that's why, for those who are not in the psychotherapy, you see them calling themselves doctors, professor. They just give themselves so many names. And in the cultural also evolving, we have pastoral counseling that is also part of this, which is the faith-based counseling. Then we also have the integrative health practitioner that keep coming up, and we also have the Islamic counselor that is coming up. So all this mixed together now in the present opportunity. So uh, based on this, where are we now? And that is our current, in our current development and intertwining of the past traditional practices as diviners with the rigid Western psychotherapeutic model as psychologists, as psychotherapists. Where are we now? Is that we are trying to look at where are the people who will have what is supported by evidence. Because without being supported by evidence, which most people may claim that yes, because I'm trained in the orthodox medicine, the medical way, the earth sciences, I should be an expert in psychotherapy. But that is part of the challenge, and this is where we are now. And the challenge is that we have scarcity of so many evidence-based individuals to be able to there's evidence to support what they are doing. So we have scarcity of practitioners. The training, there's also a challenge with the training, because when we don't have evidence-based practitioner, then we don't have trainees that we ensure the evidence are followed, the evidence are utilized, and the evidence are taught, and the evidence are supervised for the people that are learning it. And through that way, so that the individual can now become an evidence-based practitioner subsequently. So that also affects the trainers in the process because of that paucity. In addition, we also have paucity of researches because we don't have much research in these areas, and those are some of the trouble that we're facing. And because of how our traditional understanding of illness, the mechanism of disease, have now been evolved because of the Western dominance to be given one unique name, spiritual or the supernatural, in quotes. Then the practice of where the Western medicine is being looked at as being a spiritual. And because of that, it's also affecting even those who might be eager to learn, they seem to shy away from it and just abandon it. Whereas the evidence have shown that doing it the right way will get the right results. Then we have cultural barriers that are also we are facing now, which is the what is called the cultural attunement. Because with the person who want to practice psychotherapy, it needs not just it's not about being culturally competent. It's about having cultural achievement, because that will help the individual to be able to bring the skills of the psychotherapy into the psychotherapeutic milieu with the client, so that the intersubjective place where healing will take place to help the client to heal the suffering will be helpful for the person by understanding and attuning to the cultural perspective of the individual, and be able to help the individual to manipulate it rather than to say I'm competent in it. And this might be a look in those concepts that people in sociology might look at, acculturation and assimilation. People who are culturally competent assimilated into that culture, and they just try to agree with everything there, even though some of those things in the culture might be troublesome. But people who are acculturated will attuned into that culture to understand the nuances that are there that can promote and that can hinder healing, and they'll be able to use it well. And also the promotion of that cultural competency. Over promotion of it, that's the problem of it. Another major problem we're facing is worsening stigmatization of mental health. The movie industry, which are a mirror of what is happening in the literature, is still uh, pinpoint mental illness in that debilitating manner. Not give, I mean, one of the way they do is that they look at all mental health problems as just psychosis. And we know the most common mental health illness are anxiety disorders, because there are many type of them. They're the most common ones. So people who have them don't see the need to come and be treated. And they are more likely to even benefit from psychotherapy than the medication. There is also lack of integration between the traditional and the conventional, despite the ability going up, because people are just trying to do things that without looking for evidence to support what they are doing. That which part of the cultural and which part of the conventional are this intertwining will be helpful and be effective. And lastly, which is one of the very big problem, is the supervision challenges. Even when people are trained in psychotherapy, they have the requisite evidence-based knowledge. They are trained by evidence trainer. The trainers must also be competent as supervisors in supervising psychotherapy for the trainees, in order for them to develop competence as time goes on. And this is one of the main challenges that we're also facing in our current historical development. So these are some of the historical development of where we are now. So moving forward, and that is uh, where what are we going to do about it? Of course, this slide is left blank deliberately, but I will tell you part of what we are trying to do to move forward, which is part of why this forum that we have is being created. Hopefully, more forum will also spread across the country to see that we can be able to bridge some of those gaps, some of those challenges that are facing in the current, so that we can increase the training with evidence-based approaches, create more trainers who are evidence-based as trainers, and create more supervisors who are evidence-based supervisors, not just anybody trying to come and supervise people for the psychotherapy. So that's one of the way moving forward that is being looked at. So in conclusion, I've tried to discuss that for psychotherapy in Nigeria, our evolutionary experience have shown that from where we started from, which is the diviners, and the several ways they exist now, we still have the element of the past, the pre-colonial time, and we have them with and now in the post-colonial era. Those are still there. There is hybridity going on, but it has not been very helpful. There have been so much rigidity on both sides that have not allowed evolving of the practice. So this is that the best of the two sides can be used, and this will be more helpful where we have evidence-based research to test them and to see that they are helpful, so that now more of those can be taught and people can practice it, and hopefully that this discussion that will follow will help us to be able to see that we have context to look at how psychotherapy has evolved from the past, where we are now, and what all of us can do together in order to move it forward. Thank you very much. And we'll go to the discussion. Thank you so much. Thank you for letting me rant for some time. Appreciate it. Prof, sir, I'm great to have finished the
All right.
presentation, sir.
Thank you very much, Dr. Abiola. And I hope you've noticed that some claps are still going on for you. The discussion has been able to guide us through this morning. We're going to have two sets of the discussions. One, the first set will be based on the lecture we've heard. And after a discussion on that for some minutes, we'll now move on to the, the way forward. The conclusion was how do we move forward from here? You alluded to people supervising and teaching and moving forward. So that will constitute the second part of our discussion. The first part will be on the lecture we've had. Maybe I'll start with keeping the ball rolling. Dr. Bella, you seem to be saying that the origin of psychotherapy in Africa, in Nigeria especially, would be from the diviners. I don't know. They didn't use the word diviners as such. But what I'm really asking, how is spirituality psychotherapy? Because that's how you are looking at it. That people were trying to heal, spiritual healing, the people who evolved into psychotherapy. I hope that I got it well. That's what you said. And if you said so, why do you think it's the direct evolution of what? So that's why are you thinking that it's an evolution that evolved into psychotherapy? That's the point. How is spirituality or the diviner? Remember, you mentioned that there are two types of pre-colonial healers in Nigeria: those who use herbs and those who did diviners or who are diviners or spiritualists. Why are you thinking that? What's the evidence? Or why are you saying that the spiritualists or the diviners are the ones who evolved into psychotherapy? That's my question. Maybe when you answer that, other questions will come up. So that's my own to get the ball rolling. I
Uh,
hope you get the question.
yes, sir. Thank you very much, sir. Why I say that is that based on our discussions and with other people, and also looking at archives that I've tried to look at history of medicine in Nigeria and history of health science generally in Nigeria. Part of what they have found that, and this classification was based on the already documented historical evidence that the diviners, yes, they are called diviners, but they exist mainly as priests. There might be hybridity even then of a diviner also being an herbalist as at that time. But often the diviners occupy some special roles. And the diviners then they use talking therapy to achieve their goal. They are the one who will use some elements in nature, whether they use the beads, they use cowries, they use stones. They use this as a tool to help them to make diagnosis, so that the way the interpretation of how the tools or the sound they've looked at, the calculation they've made out of it, by adding one plus one and based on the number they emerge when it's already there in their mind, already memorized, that somebody who scored this is likely to have this diagnosis. And it is then they now make verbal prescriptions, verbal interventions for the individual, and that has been documented that help them to be able, well, once they adapt that, it helps them to flow and try to get well. But now how it evolves, because the priests are the one doing that as part of being a priest, apart from leading the people spiritually, but they're also doing the work as therapists, providing that verbal cure for people. And because of their primary role as priests, then people that come there, they are not able to separate the two. And as time goes, they too, they merge the two together to look at it that is the spirituality that they try to preach. And that's why most history of medicine try to say that everything started from the supernatural. Yes, there are supernatural elements, but there are also scientific. I mean, there are also mechanisms they use, which are often not based on the supernatural. They just use some tools to make some calculation based on documented evidence, and based on that, and based on what they may call the odu, the interpretation of what that thing come to be, or what we might call in the modern we call numerology. For people that the Western world look at it, they call numerology, looking at the sun and the moon, calculating people and say people who are born between this month and this, they call them Pisces and things like that. But traditionally, there are also similar science like that, rudimentary science that, and it's still part of what people learn today. But the challenge now is from the traditional viewpoint, because of the merging of the herbalists and the diviners together, not as priests, but people try to make diagnosis and they treat. But in the due to the colonial dominance, they are looking for what people still yearn to, and that makes them to look that things that can make their clientele not to disappear is to label all illness spiritual problems. And because early illness for them is spiritual, it helps anyone with early illness to go there without being stigmatized, because part of the problem of labeling someone suffering is also stigmatization. They are real, but that will not stop us from labeling, because without that we cannot provide the right set of treatment for the people. And because of that stigmatization, they find a way to evolve over it, whether as a local traditional healer or as a spiritualist. And so they try to, and that help them to reduce stigma for people seeking their services. And through that way, it help them to get to sustain their clientele. Whereas they may not do the same thing for everybody that comes, but the message they will give to the public is the same. The problem is spiritual in nature. And when you come, what you will do, they may not tell people. So because some of their practice is shrouded in secrecy. So, but that is what they do. And that is why spirituality as of now has evolved from what we might understand, which the science have tried to look as what is the soul of spirituality, which is spirituality is to have a sense of meaning and purpose in life. And what we help one to get it, one of the biggest vehicle to get it is religion. And through religiosity, people should grow. And when they practice the religion well, then they have better sense of meaning and purpose in life, and they are able to deliver on that. But when people don't practice the religion well, of course they may be religious, but the essence, the benefit of that, which is spirituality, we find it very low in them. So, and that is why the concepts come to be, and try to look at what the people are trying to say is essentially different. For instance, in the cultural, in the present now, for people that have nocturnal seizures, the traditional interpretation is for the individual to say he has a spiritual husband or a spiritual wife that come to have carnal desire with the individual at night, and that's why the individual will be messed up when they wake up in the morning, he or she. So, and this individual is not having nocturnal seizure, but it is interpreted as a spiritual problem. And so when people go there, they keep going there, but when they come to us and we give them medications, it does solve the problem. But however, because of the belief that be associated with it, what needs to be which also needs to be reframed for the individual to keep healing, to understand that this is a disease, this is the treatment, and your spirituality is not affected because of this illness. That is missing, and that may be part of what the challenge we are facing, because spirituality is not the person's problem, but now it starts like an implanted problem for the individual, so that the individual keep looking for a spiritual core rather than looking for something that is not spiritual to get the treatment from it. I don't know if I'm able to answer the question as AXA.
Yes, Dr. Abiola, that's a long answer, almost as long as the whole discussion you already led us to.
I'm very
I
sorry.
had a simpler answer in mind,
Thank you, sir.
which you mentioned along we're talking. You mentioned it along as we're talking. That the psychotherapists heal or treat without a physical thing. They don't use herbs. They don't prescribe drugs. Talking therapy.
Yes, sir.
And that's exactly what the diviners do. They talk. They usually don't give someone things to swallow. They
Yes, sir.
don't give herbs. Yeah, so they do talking therapy. And that talking therapy is not new in Nigeria.
Yes, sir.
Even before the colonial masters came, people were using incantation, that's talking, and maybe interpretation of the dreams and stuff, also talking to
Yes, sir.
effect treatment, as against the other set of native doctors who were using herbs to treat.
Yes, sir.
And like you said, not just in the three big languages in Nigeria, small languages all have differentiate healers who use herbs and healers who do not use herbs. Those who do not use herbs are really those who do the talking, and
Thank you
they are
very much,
the
ma'am.
people involved in the psychotherapy. So that's the short answer. But you mentioned it in your long answer.
That's
So thank you very much for that.
Thank you, sir.
Now, thanks. Now, yeah. Are there any other questions? I started by being the first person to ask my own question because we're still discussing on the lecture itself. Are there any other comments, questions? Maybe we should do all at once for the lecture. Any questions? Any comments? Since are not too many, you can unmute yourself and then you ask the question or mute yourself and make the comment. Please just unmute yourself and make the comment. Don't wait for someone to point you out, please. Any questions? Does it mean that, okay, fine. Even if there are no questions, are there any comments? Well, Abiola, I think everybody understood it so well that nobody wants to ask a question or wants a comment to make.
But of course,
Hoping I'm being heard. I didn't hear that.
I said probably I've caused a lot of confusion, sir.
So if you cause enough confusion, people would state that they're confused. All right, maybe they want to talk about the second thing, the way forward. In the I don't know, are there any non-psychiatrists who are in the present in this discussion, Dr. Abiola, please check.
Yeah,
Are there any non-psychiatrists who are?
there are, sir.
Okay, all right, okay. All right. So what's the way forward? So are there any comments on the way forward? Maybe I should be the one to start another problem, the way forward.
So somebody say he would like to speak.
Please let the person
He
unmute
just
himself and speak.
Please, Gista, kindly unmute yourself.
Um, Good morning, my teachers, my colleagues. I want to appreciate the presenter for the extensive and educative lecture. The question that I have is that going forward and considering the patterns and the approach of the traditional healers and the diviners. In what way can we collaborate optimally with them without undermining the ethics of psychiatry? More so that most of their practices are shrouded in secrecy, and some might be even the ethical basis of some of the things they do might be questionable. How do we collaborate with them objectively and optimally going forward? Thank you.
No, I can't remember Dr. Abiola suggesting collaboration. If I understood the lecture properly, I think he's just telling us the, the evolution of psychotherapy in the country. He's not talking about evolution of. We just talk about health how health practice evolved from the traditional. I mean, the same way that how do I put it? The 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 gynecologists, for example, how do I put it? Have
Traditional birth
the
attendants.
traditional birth attendants. Okay, the physicians also have the native doctors. How do they collaborate? So I think the person who asked the question should really tell us how are people collaborating at the moment. And I don't know. Are you saying? I did not suggest, if I heard him well, that we should do extra collaboration. He just mentioned them to show the evolution. I don't know if I get that. Dr. Abiola, I don't know. Am I right? That will
Yeah,
you?
yes, sir.
Answer this one?
You are right, sir. Because what I'm emphasizing that we need to understand our own thought first. Because without that, then we might be lost. That's what I try to suggest, and that's part of the way forward. Then that's part of why this training, so that when we understood essentially what is evidence supported as psychotherapy is concerned, then will help us to move forward. So that when the collaboration, if we did get there, it's not part of the, but if we did get there, then we will know how our evidence work, and we can look at what they brought forward and how the evidence will work to see maybe probably then.
Thank you, sir.
Thank you very much.
Yeah, are you fine with that?
Yes, yes. Thank you,
Because
sir.
okay, all right, thanks. Okay, because I was for once wondering whether he was saying we should go back to traditional, to native doctors and learn diviners. So
Hello, good morning. Can
Good
you hear
morning.
me?
Yes, we can hear you. Please kindly go ahead.
Good morning. My name is Eji Ahmed.
Welcome,
Thank you
sir.
very much for a very enlightened lecture.
Thank you very
I
much, sir.
was wondering,
precaution. Sorry.
No, it's Professor Ahmed that is making comments.
Okay, please. I am using a phone, so I'm not really saying much. All right, Prof. Ahmed, good morning.
good morning, sir, and thank you very much for a very enlightened. I'm hearing myself. I hope I'm not hallucinating.
No, you're
It's
not. We're
not.
also hearing you. We're also
Okay.
hearing you. So this hallucinatory experiences is shared.
Dr. Abiola, well done. This is a very exciting lecture. But I was just wondering, it won't be, I wouldn't know if we're talking about psychotherapy or we're talking about healthcare delivery and diagnostic process within the African culture. That was where I got lost when it comes to psychotherapy. I wonder if you want to also comment on psychotherapy by environmental manipulation, how we use our environment in terms of offering of sacrifice to deal with our anxiety, which in most cases can be Yeah, somebody need to mute himself. Can I go ahead? Hello?
Please go ahead. We are hearing you. Go ahead.
Thank you
Please go
very
ahead,
much,
sir.
sir. So I'll make it brief. I wonder if you could just comment on psychotherapy by environmental manipulation. I think there used to be an entity like that. Maybe I missed it in your lecture, the Awari Tefe way of psychotherapy, looking at what was done in terms of how do you address your anxiety, the basis of your psychopathology, by appealing to the spirituality through manipulation of your environment. Thank you.
Uh, Thank you very much, sir. Somebody needs to unmute himself. So in order for the audio, maybe someone is using two devices. So if you can unmute one, okay. Thank you very much. Uh, if I may, I'm not an expert on environmental manipulation, so I might not be able to give you much about it. I wish Professor Aina is there, but Professor Udofia will be able to talk more about it, hopefully, as the discussion goes on. But I can tell you from the published work of Professor Aina, uh, environmental manipulation is a psychotherapeutic modality that took place while those people who are seeking to solve their psychological ailments that they are facing. He did mention through his paper about going to the prayer mountaintops, sleeping with them, watching them, doing the religious rituals with them. But he found that there is the environment helps to manipulate their psychology in a way that, and that manipulation, which is their psychological environment, and that manipulation was good enough to help them to have a kind of cognitive reframing of their problem, and through that way it helps them to get healing. One of the mechanisms that underlie probably would be hypnosis, because for people are usually referred to such places which have hypnotherapy uh, uh, level elements to it. So because when somebody have problems, is looking for solution which are psychological in nature, the psychological suffering is there, and for the individual not to understand that it's a psychological suffering, and it has been interpreted as a spiritual suffering for the person. So the individual moves to move around, and people keep referring, no, go to this place, go to that place. So for where they might get sources, the environmental manipulation do play a role there, and it is one of the ways to move forward, because it is one of the area I felt that we need to go and get exactly what it is, what are the elements in it, so that because without that we cannot teach it to ourselves. This was one of the therapy that was created by Professor Binitie, and the creation of it, as he has presented it, he has used it, and that's what helped Professor Aina to do a research on it. So I'm more attuned with the research done by Professor Aina. I wish he's here so that I can tell us more about it. But I'm aware of that. But I want to believe Professor Dofa will be able to tell us something more about it, hopefully. Uh, the
Yes, I think I should jump in now.
Yes, sir.
Professor Ahmed, the lectures, there are people who are going to give lectures on those aspects, the psychotherapy by environmental manipulation and stuff. But I am understanding your question in another way. I'm also trying to see that to state that, I asked a question. My question when we started was how Dr. Abiola is saying that psychotherapy evolved from the priests and the diviners. But in my own response to that, I mentioned that we both use talking therapy, but I'm also accepting, as you have, I don't know whether that's what your insinuations were, but if we also say that psychotherapists manipulate environment, that people that getting healing from talking therapy or getting healing when the environment is manipulated. I think the use of those two things would make psychotherapy a direct descendant from priests and diviners. I don't know if that's what you were trying to imply, but if I'm answering that my question, if I'm answering it next time, I'll say that we both use talking therapy, and that many of us also use environmental manipulation in effecting healing to people. So that's how I. But seriously speaking, there's a set of lectures as we go on that will be dedicated to psychotherapy by environmental manipulation. So maybe at that time we'll be able to get the details of it. There's no today's lecture was just an introductory thing. We're going to have a whole lecture, maybe a series of lectures on different types of psychotherapy, so that by the time we finish, we'll be able to get it. I mean, I'm so sure we'll be able to get Professor I know and any other people who Waritefe himself, if he's still able to help to lead discussions on this. So thank you, Professor Ahmed, for reminding us that both groups of people also do help cause healing or effect cessation of symptoms or mitigation of symptoms using environmental manipulation, not just talking therapy, but they both manipulate the environment to cause healing. So I see your comments, more of the question you asked as more of a comment to remind us that both methods are used by the two groups of people. Are there any other comments?
Just a little bit addition to that. Thank you very much, Prof, for your
Okay.
comment. I think
Okay.
it's setting the stage for how cognitive behavior therapy has a very significant African basis. If you look at our ways of healing or seeking help, we, if you look at it traditionally, we've always manipulated our cognition, our thought pattern, as much as we manipulate our behavior. And that area of manipulate, the conceptualization for me, that manipulation of behavior or psychotherapy by environmental manipulation rests on that. So this has always happened. The prescription of sacrifice, the the the, the process of looking at the way we think about things, we've always addressed it. And I think you touch it a lot when you're talking about the Oduifa and how the Oduifa advises us about what the future holds and so on, numerology and all the very nice theories that we put across. So really psychotherapy, whatever form, is not alien to us, as Prof said. We talk and we manipulate our environment to get healing. Thank you.
Okay, thank you very much, sir, for that. Uh, Prof, sir, if I'm
Okay, now for the way forward, it seems there's nobody else asking questions about the lecture. What about how do we move from here? Maybe moving forward, I think I should start with a question. Why medical psychotherapy? Why not just psychotherapy? Why are we that clause? Is it not divisive? Or sorry, maybe I should put it better. Every psychotherapy is medical. So why medical psychotherapy? Are there psychotherapeutic interventions that are not medical, where medical means attempt at causing a change or improvement or cessation of symptoms? Dr. Abiola,
okay,
why?
thank you very much, sir. What I'm trying to say is that there are many routes to become a psychotherapist. Uh, being the most of the founding founder of psychotherapy, medical psychotherapy, it's just because not to forget those founding foundation. because most of them are medical man, and before they evolve to become psychotherapists, and which they practice. So yes, the terminology is not because it's not segregation in nature, but it is something that is unique only to the psychiatric practice, for the reason that it is the always in psychotherapists who have the capacity by law legally to prescribe also while giving that, uh, that apart from be able to give that they also have other approaches to make diagnosis, not only through formulation, which other psychotherapists will have to learn in order to be able to make sense of people's suffering, in order to be able to offer healing. But for the psychiatrists,
So, sorry, maybe I should interject, Dr. Abiola. I hope you don't mind.
yes,
I asked you, there are some people who are in psychiatry. I don't know, are there any psychologists who are present with us? Are there any social workers who are present with us?
uh,
How would they see the term medical psychotherapy? Would they see it as uh, trying to I don't know, would they be comfortable with that term? That's actually my question.
and that's what I was just trying to explain it. It's a term that is encompassing. It's encompassing that it will need to accommodate everybody into it. So uh, primarily it started with to look for how to improve the capacity of the psychiatrists there. They improve their capacity for psychotherapy. But nonetheless, it's what has happened. There are many people that show interest, because the name will evolve with time in order to be able to encompass it. For the simple reason that this is one of the areas that uh, one of the areas where uh, providing or having these skills, knowledge base are needed, and it's not only restricted to psychiatrists, and that is why this is accommodating everybody.
Okay,
Yes,
so maybe the medical there is not for people who are participants or members. The medical in the term medical psychotherapy is the reason for the psychotherapy.
yes, sir.
That is, if you are conducting psychotherapy to cause a change, to relieve symptoms, you understand. So it is not in who comes, but psychotherapy being used for treatment purposes. I think that's what we're talking about. I don't know if that's okay. Is that a good summary?
Now that is where it has evolved to. Yes, sir.
All right, okay. So anybody who is doing psychotherapy to alleviate symptoms or to mitigate symptoms is welcome to the psychotherapy. The psychotherapy now is being used for medical purposes. I think the term, there's a form of psychotherapy that the name medical is always associated to differentiate from other things. It's something like hypnosis. There's medical hypnosis. People do hypnosis as magic. They do hypnosis to get advantage over others. But medical hypnosis is done to cause changes or healing to people. I think that's where the meaning of having medical in the name medical psychotherapy for us. I think that's the way we should understand it. In which case, anybody who is learning or practicing or picking up experience in psychotherapy to help people who are suffering from who have symptoms, and the aim is to reduce those symptoms that would fit medical psychotherapy. All right, I think that's the core thing we needed. I need to ask. Are there any other things on the way forward? What other thoughts do we have on the way forward?
Maybe Professor Ahmed wants to make a comment on
All
psychotherapy
right.
versus counseling.
Okay, good. That's perfect. That's very good. That's Professor Ahmed. Let him go on, please.
He make a note. Prof, sir. Okay, probably is off. Okay. Well, just to keep the time until Professor Ahmed comes in, is that yes, psychotherapy versus counseling, they operate on similar way, but it is the depth of what is needed and the depth of
No,
the,
I think okay.
yes, sir.
Dr. Abiola, which side is it, me or Professor Ahmed? Because I'm not sure I'm being heard again.
Okay, you unmute yourself.
No, what? I don't know. Am I muted? I don't think I'm muted.
No, then, but momentarily, uh, Professor Ahmed seems to not.
No,
However, just to take note that this group is not recognized as medical psychotherapy group, if I may say that. This group is a psychotherapy study group. Hopefully, it might evolve. So, medical is still not part of this group. I'm just providing information for the group about some of the nomenclature and terminology that exist. And yeah, some might be controversial, might look divisive, but the confusion is not there. Just trying to explain what the basis is like. And it has been better put by Professor Udofia about what is psychotherapy going to do in the context of somebody suffering, illness suffering, and that is to provide the medical healing there. That may be the context it might be a look at, not because it's exclusive to some group or otherwise. That may just be the clarification to make on that. Uh, the reasons that psychotherapy can be done for non-illness related issues, but our focus primarily here is about to see how to develop people's skills so that they can be able to treat people that come with mental health challenges that would need talking therapy as part and parcel of the treatment for that. Thank you very much. And about the psychotherapy versus counseling, like I'm trying to say, is that the two of them need similar, need knowledge base that looks similar. But the depth of knowledge of one is different. For psychotherapy, the depth of knowledge of what is needed, the depth of skills, the depth of practice differs. Just like we might have a cognitive behavioral therapist or rational emotive behavioral therapist, there might also be a cognitive behavioral counselor or rational emotive behavioral counselor. The essence there is that the distinction will tell about the depth of the health challenges that they can deal with, the depth of uh, the help that they can offer. I think that's what make one of the distinction from what I know. But I want to believe that my teacher and everybody here are not the first time learner, and they have understanding of what this should be. And hopefully, this is some of what this session will help to address. I don't know if Professor Ahmed, if he's back, if he wants to comment on that aspect, that would be great. Or any other person that said, because I believe all of us are here and we have understanding of that, and that's why the discussion is will be part and parcel of it. And as part of what we've agreed to is that for every thank you, sir, Prof. Say no further comments. But like what we agreed that for every lecture that is delivered, we'll use the whole week to continue the discussion. So please, our time will agree to stop by 12. So I will pledge that all of us that are here, that are present, our WhatsApp page is for the discussion of what has been talked about for the day. Hopefully, when the recording of this is available, we'll make it available to us. But please, let's have it in mind that we should all keep interacting with this and let's keep the discussion flowing because that will help us to improve our understanding. And like Professor Duffy have said, if you don't know where we are coming from, we might not even understand where we are, not to talk of knowing where we are going to. So the essence of this is to help us lay the foundation so that we can understand where we are coming from. So that from where we are coming, we know why we are where we are today, or even understand where we are today. Hopefully that then our moving forward will be based on at least good knowledge, not just based on assumption, assuming one thing or the other. So that this is part of the rationale for why this sounds to be one of the logical things to give. So I hope the discussion will carry us further on that. Uh, some of the lecture we'll do is also to provide uh, foundations, to provide what will be the scientific understanding of the mind. So that lecture will be given when Professor Reddy is back, and he will join us and he will give that lecture. Professor A.G. Ahmad, who also spoke, is also one of our resource person. We will give Professor Udofia is our father and resource person on the group, and they will give, and many others will be there as they come onto the group. I will be introducing them to us, and other people will be introducing it to us to see what we're doing. And let me thank our Father Professor Dofia for creating the time and energy to do this for us. Let me thank Professor A.G. Ahmed all the way from Canada. I'm sure the timeline difference is there, but because of dedication and devotion and his passion to see that he wants to contribute to our capacity building, he sacrificed to be with us. And so I want to believe that we'll be able to move us forward with this. And please, let's look forward. There are more interesting lectures that will come up and that will build our capacity, and we will start moving because we need to build the capacity from day one. We don't want to make assumption that people already have, so we are building forward. So maybe one of the next you might pick next might be either counseling or psychoeducation, which is part and parcel of our practice, so that we can look at it in the and so that we can be doing the right way, and hopefully we'll get some supervision to do that, so that as we do it, we keep developing the skill adequately, so that that will ensure part of the moving forward is assured. I think somebody raised up his or her hand, Dr. Kumbak. Or, so I don't know if you can unmute yourself and speak, please.
Sorry, sir, it was a mistake. Thank you.
Okay.
Thank you, sir.
You have spoken, Steve. So thank you for speaking. Thank you very much for that. So please, let's remember discussion continues throughout the week, and let's keep it going on. We can bring up what we felt that we need to do more about it. What will be your expectations? The page is for that, for us to keep the discussion going on. For everybody that have taken time to be with us, thank you very much. This made the effort worth it, and I assured you that as we go on, definitely we'll all build the skills together, and we will grow so that we can help. The focus is to see that we can help every suffering Nigerian with evidence-based approach. It's not just to give advice, which is part of the trouble. Advice is different from counseling. So because we don't want to, we want us to change that approach of just giving advice and we say I've counseled the person or I've given therapy to the person. No, that's not it. Advice is quite different, and without having that understanding, then that would really be a major trouble for us. So this is part of what we hope to achieve as we grow onward from here. Thank you very much. And if there is no further comment, I will thank you all that you should help us thank our father, Professor Dufia, for being here. Thank you, Professor Ahmed. Thank you, everyone. I can't mention everybody's name. Thank you very much for all being here. Thank you so much. Please, I may not mention some people, but pardon me for not being able to do that. So I look forward to our next week event, but our event continue on the chat, please. Thank you very much. Prof, sir, Professor Dufia, sir.
Gentlemen and ladies, I must join others to thank Dr. Tajudeen Abiola for uh, being the lead lecturer today and giving us a good start. Like I said, in the next 2 minutes that we have left, we just want to thank all of us for being present. That's the advantage of fixing things when people suggest. I mean, we had a pool, and many of the people wanted it on this particular time. And thank you for showing up. The next week or thereabout, would have another lecture, and I'm sure that more people would show up. But like Abiola has reminded us, this is just the opening of it. The core of the lecture is going to be done during the chat group. So we are all welcome to the chat group. If there are other people who have interest in psychotherapy, you can let them send a formal message to Dr. Abiola so that they can be included to be in the group and subsequent times. So thanks a lot for giving us the time, a part of your Saturday. And we are still open the rest of this week in the chat group for discussion on it. I'm sure things people didn't say during talk, they would say during chat. So we're all welcome to the chat. Thank you very much. Thank
Thank
you,
you.
Abiola, and thank you,
Thank you
Ahmed.
very much. Thank you, everyone.